Okay, so good afternoon. Today we're going to be talking about fibroids and what we can do to treat them and kind of the differences between some of the different treatments for fibroids. Thank you everyone for joining, really appreciate it. Let's get started here. Okay, I'm Dr. Jacob White, the Medical Director of USA Fibroid Centers. I've been here for a few years and we've treated a lot of fibroids. We've treated a lot of patients. And so I'm really happy to bring you some of this information today. Previously, I've worked at other hospitals like Drexel University, Georgetown University, and the National Institutes of Health. So we're going to be talking about fibroids today. What are fibroids? What are some of the symptoms? How do we diagnose fibroids? And what are some of the fibroid treatments that we do these days? One that you might not know about is fibroid embolization. That's something we do a lot of. We'll talk about what fibroid embolization is, how does it help those patients with fibroids, and how you can kind of choose a good fibroid treatment option for you or your patient. At the end, of course, we'll stay on for Q&A session. I'm happy to take questions over the microphone, or you can type them into the chat box as well at the end. So what are uterine fibroids? They are non-cancerous growths. They're within the uterus. They are within or attached to the uterus. And someone can have one fibroid, or more often, there are multiple growths. Most patients with fibroids have more than one. They generally have a handful of them. And they range in size. They can be tiny, or they can be very, very large. And they often cause a lot of debilitating symptoms. Here's a graphic of a uterus. And as you can see, these fibroid growths can occur at any point, at any location within the uterus. This middle portion, if you can see the arrow here, the middle portion of the uterus is called the endometrium. That's where patients bleed from. That's where a baby grows. So these fibroids close to here are called submucosal. Those are ones that tend to do a lot of the bleeding symptoms. This fibroid on the left of the screen, that intramural one, is buried in the wall of the fibroid. And then all the way on the right of the screen, the subserosal fibroid is all the way on the outside of the uterus. As I'll talk about in a second, depending on where the fibroids are in the uterus, that generally dictates what the symptoms are and how we can treat those fibroids. So generally, fibroid symptoms either come as bleeding symptoms or pain and other what we call bulk symptoms, where the fibroids are pushing on different areas of the uterus or the surrounding organs, and that can lead to a lot of very uncomfortable symptoms. Like I said earlier, fibroids in that inner portion of the uterus near the endometrium, those cause bleeding symptoms, prolonged periods, heavy periods, a lot of clots, irregular bleeding, whereas fibroids on the outside, they don't affect the bleeding as much, but they can push on the surrounding organs. They cause a lot of pain, bloating, urinary frequency, constipation, a lot of those types of symptoms. And like I said before, most women don't have one fibroid. If you do have fibroids, you have a few, 5 or 10 or more, and most women have both of these types of symptoms. Here's a couple examples. Once we see a patient, we like to take some pictures to see how many fibroids, where they are, and do they correlate with the patient's symptoms. Here's an ultrasound. The first two images are identical, just with the red drawing around the uterus. That's what a uterus looks like on an ultrasound image. All the way on the right of the screen, here's a picture of a fibroid about 3 centimeters. It's a round mass that's growing in the uterus. Better than an ultrasound is something called an MRI. This is a much, much clearer picture of the female pelvis. This, just to orient you, this picture, the patient's head is at the top of the screen. Their front of their body is at the left of the screen. And the back of their body is on the right of the screen, and their feet at the bottom. And this image is sliced right down the middle of their body. Outlined in red, again, is the uterus, and you can see this picture is much more clear than the ultrasound. Outlined in red is the entire uterus. Right in the middle of the uterus is that white line, that white area right in the middle. That's called endometrium again. And then this black spot outlined in blue, kind of at the top of the uterus, that's an example of a fibroid. And that's a small fibroid, and it's probably not bothering this patient very much. In front of the uterus, to the left of it, outlined in yellow, is the bladder. And as you can see, there's a very close relationship between the uterus and the surrounding organs, such as the bladder. So as these fibroids grow, they can compress these other organs and cause a lot of symptoms. Here's an example of a patient with a lot of fibroids. As you can see outlined in blue, there's about 10 of them just on the slice. And if we would slide the image to the side, we would see even more. So this is a patient with a lot of fibroids. That middle white area, you can only barely see it wrapping around these fibroids. That endometrium is definitely affected. This woman had a lot of heavy bleeding. And again, you can see the bladder outlined in yellow, and it is completely compressed and smushed down by these fibroids. These fibroids are big and heavy, and they are weighing down on this bladder. This woman's bladder is unable to fill with urine, and she had a lot of urinary frequency, constantly running to the bathroom. But of course, her bladder couldn't fill up, and she never had to go. But it's very, very uncomfortable to have all these fibroids. So once we diagnose fibroids, we know where they are. What are the different treatment options to treat these fibroids? It generally breaks down to two different kinds. There's surgical treatments and non-surgical treatments. First, let's talk about the surgical treatments. There are two of those. One is called myomectomy, and that is removing the fibroids from the body. Okay, there are different ways that surgeons can go after these fibroids. It can be an entire open incision. It can be just laparoscopic with a couple small incisions. But any way they do it, they're going into the body, removing the fibroids, cutting it out of the uterus, and removing it out of the body. That's a myomectomy. Number two would be a hysterectomy, which is entire removal of the uterus. That's, again, usually done with a full open incision, and the uterus is removed from the body. These surgical treatments are good in that the fibroids are out of the body in a bucket somewhere, but the flip side of that is that it's not easy to remove the fibroids. The uterus and the fibroids are buried deep in the pelvis, and it's not so easy to do these surgical treatments. So over time, we have developed these non-surgical treatments. Number one is hormone therapy. We know that fibroids grow in response to hormones. Similarly, they can shrink with hormones as well. We can give hormone pills or a hormone infusion or a shot or a patch or an intrauterine device, an IUD. All of those ways of non-surgical treatments of fibroids deliver hormones to the fibroids to tell them to shrink down and stop bleeding and stop causing problems. The good news about hormone therapy is that it's the easiest of all of these treatments. It doesn't involve any procedures or any surgeries. The downside is it's kind of hard to stay on hormone therapy for a long time, and it doesn't always work once the patient has a lot of fibroids. The next two, radiofrequency ablation and focused ultrasound therapy, are relatively new. I just wanted to mention them to show how there's always new fibroid treatments coming out. These two are a little less commonly used these days, but they're different ways of destroying fibroid tissue within the body. But again, not surgically. We're not cutting out the fibroids. The last one is uterine fibroid embolization, which is what I'm going to talk about a lot because that's one that we do a lot. And it's a great procedure. It involves cutting off the blood supply to the fibroids. So again, the fibroids aren't benign. They're not cancer. We don't have to remove them from the body. In embolization procedure, we cut off the blood supply to the fibroids, and the fibroids essentially die and they shrink down and they stop bleeding, they stop pushing on organs, and they stop causing so much trouble. So myomectomy, it removes fibroids. It can be done through a variety of different ways. Some fibroids are accessible vaginally. That's called a hysteroscopy, but most of them involve an incision through the abdomen to reach inside and to cut out the fibroids. Now, like I said before, most women with fibroids have a lot of them. Sometimes it's 5, 10, 20, or sometimes even more. And that can cause an issue because with myomectomy, we don't like cutting into the uterus over and over again. That creates a lot of scarring. It's a very long surgery. There can be some blood loss associated with it. And so it's hard to remove a lot of fibroids. You can imagine if there's one fibroid on the outside of the uterus, that's probably one that's easier to remove with a myomectomy. However, according to studies, we see that a lot of women who have myomectomy do go on to experience recurrence of fibroid symptoms. Number one, new fibroids can grow. And number two, it's hard to remove every single fibroid with a myomectomy. Hysterectomy, of course, is a definitive procedure for fibroids. If we remove the uterus, we remove the entire uterus and all the fibroids, and fibroids can never grow again because there is no uterus for them to grow in. However, hysterectomy comes with a couple downsides. Number one, of course, it's impossible to get pregnant without a uterus. And number two, a hysterectomy is a very significant surgery. As you can see from this image, it's a full incision. We open up the patient, we have to remove the entire uterus. And once we remove an organ, there's a lot of scarring and there's a lot of what we call pelvic floor issues, where some of the muscles get damaged during the surgery. That leads to a lot of symptoms down the line. So hysterectomy is something we try to reserve only at the end of fibroid treatment. We try not to remove the uterus if we don't have to. Next is uterine fibroid embolization. That's the procedure we do the most of, and it is non-surgical. It's only done through a needle hole. There's no cutting, no scars. It's one needle hole into a blood vessel, either in the thigh or the wrist, and everything is going through that one little needle hole. We thread a long, thin catheter. This plastic catheter is less than 2 millimeters in diameter. It's a long, thin catheter that goes through the blood vessels on the inside. The patient doesn't feel that. And we thread that catheter over to the fibroids, where we inject embolic agents to cut off the blood supply to the fibroid. The fibroids lose their blood supply, they shrink down and die, and the rest of the uterus stays happy and healthy. Here's an image on the left. It's a small catheter going into an artery in the right thigh, and it's threaded up and over and down into the patient's left uterine artery. And then in the close-up image on the left, you can see where the small catheter ends in the uterine artery going to this fibroid. And we inject these little particles, and these particles plug up the blood supply, and they cut off the blood supply to the fibroids, effectively killing them. Here's what we see during the actual procedure. This image on the left is an X-ray image. So just like the picture on the right, you can see this line, this catheter going up and then down, and then ending in the right side of the screen, which is the left uterine artery. And then the dark lines emanating from that is what's called contrast. We inject that through the catheter and we take this X-ray picture. And you can imagine, you can see this kind of rounded appearance of all the blood vessels going into this big fibroid. And then we inject the particles into the fibroids and it kills the fibroids. It's a quick procedure. It takes about half an hour. And then we watch the patient for a couple hours, about 2 hours, and then they get up and they walk home. There's about 5 days afterwards of cramping, pain, and nausea. And that's the fibroids dying. So we do like to have some of those symptoms show up. And we do send the patient home with medicines to get them through that period of about 5 days when they're uncomfortable. They return to work in about a week. And then the fibroids shrink for a few months. And as the fibroids shrink down, they get smaller and smaller. And there's less and less bleeding and less pain and less pressure. And after a few months, we see the patient, we take some pictures, and we see how small these fibroids got. And then we correlate them, and generally the patients feel a lot better, and a lot of their symptoms have gone away. So fibroid embolization, or UFE, is a really great way to treat these fibroids. When compared to open surgery or robotic or laparoscopic surgery, the patient is left with a lot of scars, a lot on the skin and scarring internally, and there can be a lot of post-surgical complications from this major surgery. Whereas with UFE, the fibroid embolization procedure, it's a tiny incision, just a couple millimeters, and they walk out just with a Band-Aid over that needle hole. It's safer, there's fewer complications, it's less invasive, it's less expensive, and there's a much shorter recovery compared to surgery. Here it is in our chart form. Uterine fibroid embolization, it's done through a needle hole, whereas myomectomy is laparoscopic or complete open procedure. The embolization takes about 30 minutes, whereas myomectomy takes several hours. Plus there's recovery. You're in the hospital for a myomectomy and you're there for a couple of days and then recovering for a few weeks. The procedure of myomectomy, obviously that's what is impossible to do without anesthesia. It's done with general anesthesia, with a breathing tube. The patient is completely unconscious. Fibroid embolization is not a painful procedure at all. It's done just through that needle hole, and the act of injecting the embolization particles isn't painful at all. So a lot of patients choose to be completely awake. it can be done with no anesthesia at all. Like we spoke about before, a patient with a lot of fibroids, myomectomy is going to be very tough to remove all of them. It's hard to keep cutting into the uterus. But with embolization, all fibroids have the same blood supply. So whether there's 1 or 10 or 100 fibroids, they are all treated with the embolization. And there's a much quicker recovery. Embolization patients go back to work in a few days, whereas myomectomy patients takes a few weeks to recover. There's been a lot of data and studies done comparing fibroid embolization with myomectomy and uterus. This information is from a Cochrane review from 2014. Cochrane review studies are very high level of scientific medical evidence. Basically, they pull together a bunch of different studies that are done. So there might be one study that examines 10 patients and another study that examines 50 patients and another one that examines 100 patients. And it's hard to pool all that data together. But that's exactly what the Cochrane review does. It pulls them all together. And so even though each individual study only may have looked at 10 or 20 or 100 patients, this pulled together all that data. It was hundreds and hundreds of patients. And what it showed was that UFE, fibroid embolization, compared to surgery, there was a shorter procedure time, less likely to require a blood transfusion because we're not cutting into the uterus. There's a shorter length of hospital stay and a faster resumption of usual activities. So as you can see, the fibroid embolization is a lot easier and a lot safer than the major surgical procedures. In addition, fibroid embolization is not an experimental treatment whatsoever. It's been done for 25 years. Hundreds of thousands, if not millions of women have already benefited from fibroid embolization. It is a well-established procedure. It's covered by most insurance plans, including Medicare and Medicaid, and is just as effective, if not more so, than surgical treatment. So how can you get fibroid care? USA Fibroid Centers is a large network of fibroid treatment centers all across the country. We're in, I think, 11 states. We have 80 offices all over the place, and we're happy to treat you. In this time of coronavirus, we have opened up telemedicine care. You can contact us or go to our website, and you can schedule a teleconference from the comfort of your home. We can do a video conference or just over the phone, and you can send us your records if you have any, and we can talk to you and try to get you at least the initial consultation, talk, see what your symptoms are like, see if you know you have fibroids, and what it is we can do about that.
Learn more at usafibroidcenters.com or call 855-615-2555.